Dear distinguished guests, I would like to welcome you to our meeting. I am Dr. Genco Çetinkanat, the Deputy General Manager of Guven Health Group. I am with Professor Dilek Oğuz. She is the Medical Director of Guven Healthcare Group and the Professor of Gastroenterology. Welcome.
Thank you.
Ladies and gentlemen, Guven Health Group is one of the leading health groups in Turkey for over 45 years. It's located in Ankara, the capital city of Turkey, and just 2 hours away from Kiev. We have been internationally accredited by Joint Commission International since 2008 and we re-audited last month. So Guven Hospital is providing the latest up-to-date healthcare solutions with its state-of-art technologies, and one of them is endoscopic ultrasonography and interventional endoscopic ultrasonography. And today we are here to learn about what endoscopic ultrasonography is. I would like to yield the floor to Professor Dilek Oğuz, and please, the floor is yours.
Thank you very much again. Dear colleagues, hi. I would like to thank you for your interest, first of all. I want to talk about endoscopic ultrasonography, basic principles of EUS, EUS elastography, and other diagnostic modalities. Endoscopic ultrasonography was developed in the 1980s. A group of related techniques whereby an endoscopy is used to place an ultrasound transducer within the gastrointestinal lumen to perform ultrasonography. What are the targets? Gastrointestinal wall, wall-associated lesions, structures of surrounding the gastrointestinal tract. Endoscopic ultrasound is now well established as an important tool in clinical practice. Nowadays, from purely diagnostic imaging, it has progressed to include tissue acquisition, which provided the basis for therapeutic procedures. This progress has allowed endoscopists to diagnose and treat broad range of not only gastrointestinal disorders, but also mediastinal, pancreatic, and perirectal diseases. As you can see, on the left side of the picture, non-small cell lung cancer staging, EUS and EUS-FNA. And on the right side of the picture, distal cholangiocancer, linear EUS imaging. We have a lot of endoscopes. For example, as you can see, radial echoendoscope and the other linear echoendoscope and many probes, high frequencies specialist. EUS should be performed when it has the potential to affect patient management, such as when establishing a diagnosis, obtaining a locoregional tumor staging, it's very important really, or enabling therapeutic intervention. Endosonographic findings can be diagnosed for certain lesions, including gut duplication cysts, malignancy, subepithelial lesions, bile duct stones, extrahepatic and intrahepatic biliary system, cystic and solid pancreatic lesions, pancreatitis, all of them, liver, near-board organs, mediastin, vessels, adrenal gland, left kidney, for example, and tumor staging. However, in other situations, EUS imaging alone does not provide a confident diagnosis, and EUS-guided fine needle aspiration or core biopsy is indicated to facilitate cytologic or histologic diagnosis. Follow-up imaging may be indicated when EUS demonstrates benign appearing lesion to identify interval growth or other signs suggestive of malignancy. Endoscopic ultrasound in mediastinum and lung cancer is very important. The evaluation of mediastinal masses poses a diagnostic challenge, as you know. This is because of their myriad of possible pathologic causes their proximity to numerous vital structures, and the difficulty to access for biopsy. Therefore, US and can accurately reveal middle and posterior mediastinal lesions surrounding the esophagus, and thus the operator must be familiar with mediastinal landmarks. And mediastinal endosonography is very important, endobronchial and esophageal. The combination of endobronchial ultrasound and endoscopic ultrasonography, yes, both techniques are available in our hospital. Endoscopic ultrasound is considered a major imaging method in the management of several diseases of the gastrointestinal tract and surrounding structures. EOS has been demonstrated to have significantly changed the diagnosis and or management of up to 25% to 50% of the cases. But an accurate diagnosis cannot always be determined using only conventional B-mode EOS imaging. Therefore, developed new imaging techniques, for example, EOS elastography and contrast and enhancement ultrasonography. Endoscopic ultrasound is considered a major imaging method in the management of several diseases of the gastrointestinal tract and surrounding structures. EOS has been demonstrated to have significantly changed the diagnostic and or management of up to 25% to 50% of cases. But an accurate diagnosis cannot always be determined using only conventional B-mode EOS imaging. Therefore, new imaging techniques is developed, which is EOS elastography. EOS elastography is based on the knowledge that many different pathologic processes, such as fibrosis, inflammation, and cancer, induce alterations in tissue stiffness. Elastography evaluates this stiffness through the application of slight compression using an ultrasound transducer to the targeted tissue and recording the resulting tissue displacement from the region evaluated. Elastography can be performed in real time using a conventional EOS probe attached to processor with a specific software installed. First generation EOS elastography allowed only qualitative evaluation. Today, second generation EOS elastography also allows for the quantitative evaluation of tissue stiffness with two different approaches, strain ratio and strain histogram. On the right side of the picture, in gray scala, you see hypoechoic lesion of head of the pancreas. On the left side of the picture, we see elastographic image of the same lesion, very hard stiffness. You can see very hard stiffness tissue. So, there has been tremendous interest in therapeutic EOS recent years. Diagnosis EOS, including lesion sample acquisition, still constitute the majority of EOS procedures. It has excellent diagnostic performance characteristics, and ongoing technological progress has further improved image resolution and now allow additional image enhancements through contrast enhancement ultrasound and EOS elastography. Tissue acquisition for diagnosis is really an important component of diagnostic EOS, and access to dedicated biopsy needles has further enhanced this ability. In the coming future, we are planning to organize a lecture on EOS and interventional EOS, so be in touch with us in order to share your contact information.
Thank you, Professor.
Thank you.